So good afternoon, everybody. Thank you so much for inviting me today. I'm really thrilled to be here. My name is Dr. Amy Wineland, and I'm the Director of Summit County Public Health. And I've been leading the COVID response as the incident commander since last March of 2020. But I have a lot of experience in public health. I have actually been with the health department for 21 years now. I came here as a student, a doctoral student doing my residency, and fell in love with public health and have been here ever since. So I'm really feel fortunate to be able to have done this work here in Summit County. I don't know that I would have done it anywhere else. Yeah, it's an amazing place that we live and love, and we truly came together as a community to get through these most historic and challenging times. So I'm going to jump right into my presentation, and happy to take any questions along the way. So please feel free to do that. And hopefully you're all seeing my screen. Yes, I'm assuming yes.
Yeah.
Okay, perfect.
Yeah.
Thank you. So of course, the data tells the story and has always led the decisions that we've been making here in Summit County. But what's really good to know across our state and really across the nation, thanks to amazing vaccines, we are experiencing a decrease in cases across the state. So right here we have the state rolling 7-day average. You can see on this nice decline. We did experience a little bit of a fourth wave in the past several weeks, but we are now finally on a decline that we love to see. There were some moments along this way where we started to see quite an increase in our variant cases. We continue to see about 75% of all the samples being sequenced for variants to be that UK variant, and they're actually going to be changing how they label the variants this week. They'll be alpha, beta, etc., according to the type of variant and its level of concern to us. So we are continuing to see a lot of those here locally, although we're only sampling about 5 to 10% of all of the samples being sent to the state are being sampled or actually decoded or sequenced for variants. So, but nationally, we're also seeing about 70 to 75% of all cases are expected to be that B117, which is the UK variant. Our state positivity rate now is down below 5%. It's about 2.81%. That we've been experiencing here in Summit County, but there were some moments early on in a few weeks ago when we really were still focusing on our vaccination, but really trying to get ahead of that growth in variant cases. So it looks like we have done that. Our hospitalization rates are now finally also declining as well. So good news all around. One thing that we often get questions and have gotten questions a lot about over the course of this pandemic is how do we compare to at least, especially our other rural resort communities? And you can kind of see the epigraphs here. Up in the upper left corner is the Colorado graph for the longevity of the pandemic compared to all of our resort communities. Here's Eagle, Grand, Gunnison across the top. And then the lower graphs include Pitkin, Route, San Miguel, and then of course, here we are, Summit County on the bottom right. So it's really interesting to see, you know, that the patterns tend to follow each other, but depending on where we see different restrictions put in place, that definitely follows drops in cases, or when we loosen restrictions, increase in cases. We also can look at this according to the number of visitors that we had over our largest wave, which of course was over the holidays, beginning last fall after Labor Day. Really, we didn't see a reprieve from that holiday, and we really had that huge surge over the holidays and into the first of the year. And then we put in restrictions at certain times along that way. And every time we did that, we did see a nice decrease. And then now, of course, instead of restrictions, we're able to give vaccines into arms. And that's what's now, the result of that now is such low cases here in our community. So We know that vaccines are having a huge impact on our case incidence, and the state now is really looking at mapping that data so that we have a visual to go along with what we know is true. And so here is a graph about cases. It's cases versus vaccination. They took the top counties with the topmost or highest population rates, and so they have graphed that here. On the y-axis here on the left is the 14-day confirmed cases per 100,000, and then the x-axis here is the share of total population that is fully immunized. So you can see that those counties that have lower immunization rates continue to have high case incidence, and then we have those counties that are doing you know, all of the counties have vaccine available. It's just that we have a higher uptake here in our communities in our lower right quadrant here of the graph, including Summit County way over here on the right. And so it's just great to see the data in this way to help educate our community on the fact that vaccines absolutely are helping us to reopen at this time. And we want to make sure that everybody realizes that you know, it's everybody in our community that can take that step to help protect others in our community with having the vaccine and keep us open going forward. Some of this data is a little bit old, about a week old. I haven't received new data yet from CDPHE, but the estimated effective reproduction rate now is below 1. And what this means is that any person who's infected currently with COVID will infect less than one person. And that's showing, you know, that decreases the number of hosts and the effectiveness of the virus to spread from person to person, because we have such a high level of protection within our population. So it's really great to see this number now get below 1. Epidemiologists say that anywhere above 1 with COVID-19 specifically, we'll continue to see a higher level of spread within a community if it goes above 1. So you can see when it did go above 1, it correlated with all of the waves that we had across the state of higher case incidence numbers. And I said you can ask questions as I go along, and I have my my pictures minimized. So if you're asking questions, it might be best if we just wait till the end, because I forgot if I'm in presentation mode, I don't get to see everybody's hands. So I apologize for that. Right now, it's estimated that 1 in every 135 Coloradans are infectious. Well, this was as of a week ago. So again, we're seeing that nice decrease in the case incidence right now, which is good news. What's the herd immunity, or how many people are immune? And it's not just those that are actually receiving the vaccine who become immune, it's also those who have experienced natural disease. They are also considered immune. And right now it's estimated that the natural immunity lasts up to 8 months. And right now with the vaccine, it's estimated that we know, at least so far, that the immunity from a vaccine will last at least 6 months. But those clinical trials that were conducted are continuing to move forward and gain more information on the longevity of immunity from the vaccine, where we are already hearing that it's likely that we might need a booster dose. When and how often that will need to occur, we don't know the answer to that yet. But at any one time, at least still currently, there's about 10% within our population that has that natural immunity. Of course, that's going to decrease over time as we continue to immunize more of our population, because we'll have fewer cases. This is a great graph, and it's broken down by vaccination, by age and region across the state. So the upper left graph here, we're of course in the Central Mountain region, and the darker the color, the higher the vaccination rate that we have. So this is our 0 to 19-year-old population. Of course, only 12 to 19-year-olds are eligible currently for the vaccine. The upper right is our 20 to 39-year-olds. Again, Central Mountains continue to shine actually in every age group. Lower left is our 40 to 64-year-olds, and then the lower right is our 65 plus. So our Central Mountain region for every age group is really leading the charge. We've gotten a great response from our community in understanding the need to be vaccinated. We're also doing a good job reaching folks who might not know they're eligible by doing community pop-up vaccine clinics, and I'll talk about those here in a second. Our 7-day cumulative incidence rate, this is as of 4 o'clock yesterday, is 19 per 100,000. So we're doing excellent. You can really see that decline as our vaccination rates go up. We're really seeing our incidence go down. So it's just fun to see it in picture form. It really tells the story about our community. One thing that we will continue to look at is our hospital surge capacity. And many of you remember and recall that the reason for the shutdowns in the first place was the North Star was really not to impact our healthcare system. And at the time, we had limited alternate care sites, et cetera, set up. And so that gave the healthcare system as a whole across the state to be able to increase that capacity, not only to treat those with COVID, but also to treat those who needed that high level of care. And a lot of people look at our hospital and say, well, we weren't impacted the entire time, but we have to remember that we are fortunate to be part of a larger healthcare system in Centura. And many of our cases of COVID, especially early on when it was suspected that it was mainly a respiratory illness, we know now that it affects almost every organ of the body, where a lot of our patients were actually transferred to Denver. And we were very close to hitting our surge capacity back here in late February and early on over the holidays, because across the state there were limited beds for us to even transfer people out of the county. But for us here locally, we never did, but we need to continue to look at the healthcare system as a whole. And that is actually the only way now that we would snap back to more restrictions is if our hospital system is impacted. Our percent positivity as of 4 o'clock yesterday was 4.6%, which again is really great. Our percent vaccination covered right now, we have 79.9% of our population has at least one dose. This is based on the eligible population, and it's also based on our 2019 census data for that eligible population. That is the standard that is being utilized across the state and nation for vaccination rates to compare us to that 2019 census data. So this is those who are eligible. So that includes age 12 and older who have at least one dose on board. So again, we're almost at that 80% mark. A lot of people are also asking, well, what's our percentage of people who are not following up with their second dose? And right now across the state, that's about 3% of folks who are overdue for their second dose. Again, we're doing a really good job making sure that everyone who gets that first dose is getting a second. And then we have a system in place where we can do recall, both texting and emails to see what's going on, if we can assist people to get in for their second dose. Maybe people couldn't get their second dose because they were in isolation or quarantine, or maybe they were traveling and they weren't here on the date their second dose was due. So we have work to do in making sure that everyone does come in for that second dose, but we're doing a great job with our vaccine distribution. Vaccine availability, of course, now we are way beyond the point of this being a limited resource. A lot of us remember early on, certainly we were prioritizing our healthcare workers, and then we were able to open it up to other high-risk populations, of course, those 70 and older, and then 65 and older. And when we originally started getting vaccine, we were told from the state that it was going to be based on our residential population. So for Summit County, that meant, It didn't include our second homeowners, for example. And so early on in this process, when the vaccine was so limited, we were really requiring residency of Summit County. And then as we learned more, as we did with all different aspects of COVID, we had to change and be flexible as things changed and information came down and was shared from the feds to the state level and then to the local level. We were then at some point told that we weren't able to restrict it to residents because it's a free federal vaccine, at which case we immediately opened that up to our second homeowners. It was important for us locally to be able to vaccinate anybody who is at high risk, whether they're a visitor or not. It keeps them out of our healthcare system. And that was what was most important, was to make sure that we're getting vaccines into arms. But when we had early on such a limited resource, and we were told that we were only going to get enough vaccine for our resident population, that was a decision, a very difficult decision that we did make early on, that of course we changed as we learned more information. But right now, the good news is that the vaccine is widely available. We have all of our pharmacies, except for Walgreens right now, are providing the vaccine. Our community care clinic was a partner way at the beginning, providing vaccines. Centura, of course, provided it for their associates. And then, of course, our health department, along with perhaps some of you who volunteered. We would not have been able to get this vaccine out as efficiently and effectively as we did without our volunteers. We had over 400 volunteers help us vaccinate our community. And it was just an incredible effort through our drive-through pod, which was our most efficient way of getting it out. And we were all so happy to be there. It was our happy place, is what we call it here within our public health team, because it gave us a sense of moving forward. We knew that once we first got our vaccines right before the Christmas weekend, actually, we knew that it was the beginning of the end. And we were so thrilled to have this available and the support of our community to get the vaccine into arms as quickly as possible. So as we have moved forward with our vaccine distribution, I think what's really important to know is that, we got to a level of a plateau level where we continued to have our drive-through pods. I think the most we ever did in a drive-through pod was just over 1,500 in one day, which within 4 hours is an incredible feat that we were able to accomplish. But soon after that time, and once we were able to give vaccine to the general public, the demand for our drive-through pod appointments started to wane. And we knew that we needed to do a better job at reaching other folks in our community that were eligible, that maybe didn't know that they were eligible, or didn't have transportation, or perhaps didn't have time off from work to go get that vaccine or support from their employer. So we really needed to change our tactics and strategize in a different way to do more neighborhood pods. And we also needed to make sure we were reaching our most vulnerable population. So we did, we were able to have, really good uptake. County vaccine uptake rates are really high, again, close to that 70% or more range. But then when we break it down to our vulnerable populations, our people of color, et cetera, we were only reaching about 20%. So we really needed to shift and strategize vaccine out into neighborhoods and make sure that we're reaching, and also offer evening clinics, because we also knew that people weren't given time to get the vaccine. And also we hear lots of stories, maybe from our 20 to 29-year-olds, which we continue to strive to increase rates within that age population. We heard from them that it's not necessarily that they're hesitant to get the vaccine, but they're actually not making it a priority to go get it. They'll get it when they get it. They weren't going to make it a priority, certainly not going to schedule it on their calendar. So we knew that we needed to bring the vaccine out to the people and find ways to do that. So you may have heard of all the different neighborhood pods we are doing. We've so far done 20 neighborhood pods, and then we've done several, including bringing up this amazing resource from CDPHE. They have 6 or 8 of these buses now across the state, the COVID buses that we can have over several days and hit several different neighborhoods with that bus. And now we're partnering with them again. They're going to be here this weekend. We're going to be at the Summer Safety Kickoff in Silverthorne for the first Friday event of June. And then we're partnering with the towns now to also bring vaccine to concert venues, where we hope to vaccinate more of our 20 to 29-year-old population. We had our first concert experience, Jams for Jabs, over in Dillon at the amphitheater last Friday. We have our next one at the Riverwalk Center with the town of Breck on Saturday. So we're really excited to partner with the towns. They're also offering a free drink ticket. Some of you may have also heard of our event up at the A Basin, where we were able to partner with them. They were giving free drink tickets as well at the Basin. We hit a lot of our 20 to 29-year-olds there, said, hey, you're here, I might as well get it. And then, of course, they were excited to get that bacon Bloody Mary afterwards. So we're really looking at these unique partnerships, not just with our towns, but within neighborhoods, housing associations. We're going to start reaching out to employers to be able to come do, vaccine clinics on site for employees. We know that we're going to continue to have an influx of seasonal workers going forward. So making sure that all of our industry partners and employers are on board to advocate for their staff during orientation to get that vaccine. And if we can partner and be there when they're doing that orientation and training, then we can provide that service to our employers. But we've done our drive-through pods and gotten through the majority of the population who can and are privileged enough to be able to take time off or make that a priority. And now we're bringing the vaccine out into the community. So we're really excited, and we have plans that we're working on to make those regular occurrences in each town. And once that schedule is solidified, we'll make sure that's up on our website. And then, here is just our Summit residents vaccinated. We have almost 70% fully vaccinated, and again, close to 80% with at least 1 dose on hand. And then here we are compared to the rest of the state. We are third right now with at least 1 dose on hand or in an arm compared to other counties of the state. And that is my slideshow, but I do want to also make sure that you guys are all, I think I need to stop sharing. I also want to make sure that you're aware of the data we have on our website, because we do have quite a bit of vaccine data on our website. Of course, we have our case data there too, but on our vaccines webpage, you can actually scroll down and watch this graph grow, which is always fun. But you can scroll over all of these. We have all of our vaccines. So this represents our Moderna and Pfizer doses on the day we're giving them. You can scroll over and see how many we gave on each day, first and second doses. And this is only to our Summit County residents or anybody who wrote that they lived in Summit County at the time they received their vaccine. We have J&J represented here, which of course is only a 1 dose shot. And then we now have it listed by age group here, fully vaccinated, the percentages, and then at least 1 dose on board. And you can scroll through each of the age groups to see where we are. This, of course, is all based on our 2019 census tract data. So you can look through there. We have race and ethnicity and different graphs according to zip code as well of who's fully vaccinated. So we use this data and continue to help us help drive our decisions as to where we're putting our neighborhood pods and who we're reaching out to. Vaccination clinics. And I think I'll stop there because you probably all have some questions.
That was great, Amy. That was, I had wished the Summit Senior Board had been able to see all of your data to see how good Summit County is doing. And that's in large part due to your efforts and the county health department, and we thank you so much. But that's a great presentation. We have a couple, I don't see any in the chat, but I did send you a couple of questions earlier. Does anybody have a question that they'd like to unmute and ask right now? If not, we'll go into some of the questions that were sent to Amy. And Amy, I think you addressed one of them very nicely, the second homeowner question from early on. Thank you for addressing that.
Of course.
Dennis has his hand up.
Hi, thank you. I'm on my exercise bike, so I don't have my video on. Amy, I agree entirely that your reaction and treatment of this whole situation has been exemplary. And I know from personal experience, a couple of my friends are rather obsessive. And I got the impression they were calling your office almost daily, trying to get lined up with a vaccination. And they always got treated kindly, and they eventually got the vaccine. So good for you. The one question I have is, one of the baseline statistics that are used with the pandemic are the number of people who test positive over the people who are tested, the percentage total. Could you explain that some more? Because to me, that seems like a very squishy type of statistic, given the types of testing that did or did not occur in the country.
Yeah, it's a great question, and something to really keep in mind when you look at comparing Colorado. I didn't put this slide up, but I do have a slide that looks like Colorado has like the second highest incidence rates right now in the country. Just a few weeks ago, I think we were only second to Michigan, but it's because we're doing more testing than other states are. And so it's a pretty standard statistic to utilize in epidemiology and disease spread, the percent of cases over and per 100,000. It's a way that we can compare it more apples to apples, although, with populations the size is of ours, which we know is, 30,000 according to the census tract, even though we have surges of our population that take us up to 150 or so thousand. It isn't quite as precise as it could be for smaller populations, but it is the only way that we have to compare ourselves as equally as we can across the board. And we know, we absolutely know that we're not testing everybody who's positive for COVID. We have a lot of people who didn't utilize tests. We had a lot of probables, maybe because in our contact tracing and outbreak investigations, they were folks who were symptomatic and close contacts of those who tested positive. Maybe they didn't want to go in for a test, so they weren't counted, for example. And then, of course, we know that there was a high number of asymptomatic folks who, were really just looking at the tip of the iceberg, really, if you think about it in that sense, how many probably actually ended up having COVID that we will never know how many did.
Good. Thank you for that question, and Dennis, and the explanation. That was good. I see a question in the chat. What has caused the number of hospitalizations to increase recently?
Yeah, Bill, that's a good question. And we just made a shift of our data on the website, and now it's including residents and non-residents. We know that those folks have not been vaccinated that have been hospitalized recently. We are sequencing folks as well for variants, those folks that have been hospitalized, but we don't have results for those. There's a backup right now in sequencing at the state level. So we won't know if it's a variant that may be the cause for more severe illness. But it is important to understand that they're not vaccinated. And this virus is going to continue to spread. We will be living with this virus for years to come. And we know that if we have that vaccine on board, it is almost 100% effective in preventing severe illness and the need for hospitalization. It doesn't 100% make, it's not 100% effective in not if we're vaccinated. And so it's still important to wash your hands and stay home when you're sick, of course. But we have confidence that it will prevent those and that level of that need for that high level of care. So it's unfortunate that we're seeing that, but it's also a reminder that this virus is still here. It's a deadly virus, and can cause havoc for weeks and months to come. We know that there are long haulers of COVID virus disease. Even folks who are young and healthy have had compromised respiratory systems. Talk about brain fog continuing after the virus has resolved in their system. Some have myocarditis that continues. And so it is important to understand that those, we're still learning about that and who and why some people are at risk and some aren't. We still don't know the answers to that.
Good. Can you read Chuck's question? And that was similar to one of the questions I sent to you.
Yeah.
Good question,
Yeah.
Chuck.
It's a great question. And, we know.
Read it out? Let's read it out.
We know that there's a seasonality to the virus. We have learned that over the past year. We experienced that last summer. We had a huge, we almost had 5 times the visitors than any other resort community in the state, both last summer and during winter. I mean, it was just incredible. We knew that the advice was to enjoy the greater outdoors, which of course, those who live in Colorado, that's one of the things we absolutely enjoy, but it was incredible how many visitors we had here last summer. But most people were spending time outdoors. Restaurants had the opportunity, businesses too, to be able to have their seating outside. Of course, it's different now. We don't have any restrictions in our restaurants, although some of them will continue to have outdoor dining. So it'll be interesting to see how this summer compares to last summer. We didn't have vaccines on board either, and we're almost at 80% with at least one vaccine on board. It's incredible. And we have to trust that that level of protection is going to protect at least our residents. And then we need to continue to market the vaccine to anybody who's coming. I did say before the presentation that began that, the fortunate thing is we're not the only ones giving the vaccine. And one thing that I am asking staff to do, and I do if I'm there giving vaccine at a pod, is I'm really curious to know why now? Like, why are people who could have been vaccinated months ago, why are they choosing to get it right now at this moment in time? And it's really great to get that data because, again, we're going to use that information to market more. Some of the things that we're hearing are things like, well, they want to travel. And a lot of countries now are requiring that for travel. Some states, and I don't know which ones, are considering, vaccine passports. Some businesses might make it, and have the right to say, we're only allowing vaccinated people into our event. Or, others. I had a gentleman in his 60s come last week who said he had a coworker who was 45 who just got off a ventilator and was on the ventilator for 11 days. And that's what motivated him to come in. So, and then others are saying their employer is making them get it. And that's why they're coming now to get it. Others say they want to win dollars because that's the newest incentive that some states are utilizing, including our own governor, that they're giving away $1 million a week, and the odds are much better than buying a ticket. So why not get a vaccine? And then of course we're utilizing other incentives like a free drink, etc. But it's interesting to me to see the thought process and to understand why people are getting it. And so we're going to continue to ask for that anecdotal information. And I think it's really helpful to understand that. But we don't know. I mean, we know we get visitors from Texas and all over, and they might be people who are choosing not to get the vaccine, but we have to trust that we have that high level of protection here, and that is going to continue to keep our resident cases low.
Good. That was an excellent question and a great answer. That's good to know. We had a question, speaking of why people are getting vaccinated, come in earlier this afternoon. And this woman, I don't know if she's on the call, said, and again, this is more like a doctor type question. I have celiac and I'm allergic to local anesthesia. I'm a female. My body is clearly different from the norm. I'm curious about what you say about that. I'd like for me yet. Yeah. Can you give any
Yeah, and I think there are a lot of people that feel that way, and they want to see, excuse me. They want to see how things are going to play out. Sorry, just breathed in something there. And what we're recommending is that there's no real contraindication except for severe allergic reactions. And so what we know is that, excuse me, when we we vaccinated the majority of the population that was wanting to get the vaccine. They knew they could get the vaccine. And now we're going into the neighborhoods. And then to get those last folks who have those questions, they really need to have that one-on-one conversation with their healthcare provider. That's where vaccines now need to go, is into clinical settings. We're trying to work with our healthcare providers to make that happen. The care clinic is vaccinating folks, and they'll take walk-ins and they'll do that education. We're going to start having office hours here at Public Health, but we're really trying to also get our healthcare providers on board. This really needs to be moved into the setting where they can do testing and give vaccine and have that one-on-one conversation, make sure all of those questions are answered. And so that person can make the informed decision to get that vaccine, maybe do it while they're being monitored there. We've had people, even with severe allergic reactions, able to get that vaccine when they're under supervision of medical care. And so it's not that they can't get it, but it's that they want to make sure that it's safe, and that conversation can take place with their healthcare provider.
Excellent. So I hear your suggestion, or I hear you saying we're coming up to the point where your actual doctor might be able to provide this, and you trust your doctor. This would be the person that you would want to talk with.
Absolutely.
To convince. Oh, good.
Yeah.
Okay.
And we're always available at Public Health to have those one-on-one conversations too. But, and we can do that, but there's nothing like that trusted relationship that you already have with your healthcare provider.
Good. I had one question that I put in the email to you, Amy. How will the county respond to the upcoming new CDC guidelines, which, I mean, they're coming out a lot. I think there's some on Friday. Are we bound, Summit County, by Colorado state protocol, or are we on our own? Like, are you making the decisions?
Yeah. So we follow CDC guidance, and of course we're obliged to follow whatever CDPHE has in their order. We can never be less restrictive than the state health department orders or the executive orders. We can be more restricted if we want to be. And we have had times across the pandemic where, looking at our data and knowing our incidents and our unique variables in our community, that made it necessary, I felt, to put in stronger restrictions to keep our community safe. And but right now actually is an example of that, because the governor did let go of his mask order, his executive mask order, and now is only highly recommending those who are not vaccinated to continue to wear masks. We agree with that, but there is a segment of our population who is not eligible for vaccine at this time, and and are congregating in certain settings, and that's our children aged 2 to 11, who I believe are still at quite high risk if they're indoors, and they're only amongst that population. So this would be in childcare setting and indoors at camps, summer school settings, that those folks will need to continue wearing masks here in our county, but certainly not outdoors or anywhere else. But still highly recommended for anyone who is not vaccinated to continue wearing that mask. They are going to continue to be vulnerable to the virus. We see that with our hospitalizations right now, and they are going to continue to be able to spread it even to those who are vaccinated. And so I think it's really important for them be honest with themselves and their community members and wear that mask if they choose not to get that vaccine. But for that population that can't get vaccinated right now, we're going to continue to have them wear masks when they're indoors and only within others in that age group.
Anybody else who's online have a question for Amy here?
Hi, this is Mark. I don't know if you can hear me. I can't. I'm on the phone. I don't know how to write it in. So.
We hear you, Mark.
Hi, Mark.
Okay. Hi, Amy. So I have a question. We brought it up yesterday at our senior board meeting. It's about allowing people to come in to events with the senior population who are more vulnerable. Whether or not we can, one, ask if they're vaccinated. Two, can we say that we only want people who are vaccinated to participate in senior events at this point, because there may be others who are not vaccinated, cannot get vaccinated, that are vulnerable, or because the recommendation is if you're already vaccinated, you're free to go around without masks or whatever. But if you're unvaccinated, you should wear a mask. But that's trusting people, to be honest about it, and not put others at risk. And as you said, people who are unvaccinated can continue to spread the disease to even people who are vaccinated. And if you look at the data, the rate of infection in people who are unvaccinated is as high as it has been even back in December and January for the general population.
Yeah, the virus is smart. It's going to continue to find hosts. It will. And, it's a great question, Mark. We're getting it a lot. And it's really up to each nonprofit, each business, each group to make that decision. It is not a HIPAA violation for you. I did ask this at my last CDPHE call of the State Health Department attorney. Of course, you should always consult with whoever you have giving legal advice for your group, but it's not a HIPAA violation to ask if people are vaccinated. They don't have to tell you they're vaccinated. It would be on the honor system. You could require to see vaccine records if you guys wanted to get to that point. But it is, I think, it's all in the messaging. I think you as a group need to decide what risk are you willing to take? You're right. This is a high risk age group that's been desperate, as all of us have been, to reconnect and be together again, face to face, and hug again, because we can with vaccines on board. And, it's really, you're relying on your membership to do the right thing and to wear their mask if they aren't vaccinated. And certainly people who are vaccinated, if they don't feel comfortable, can continue wearing their masks. But you are, you're in a place where you are relying on the honesty and integrity of those individuals. And I'm an eternal optimist, so I hope that people won't go into, the senior dinners or other events that you have and not wear a mask if they're not vaccinated. I hope they understand the risk they're putting themselves in, and certainly others if they don't. But I can't say the health department says you should do it. I do think that you need to weigh the risk and benefit of making that decision, and for the safety of the membership.
Good. Does that work, Mark? Yeah.
Yeah, well, that's kind of what I expected. No, it's what we talked about yesterday in our board meeting too. Just as an aside, I mean, we'll probably encourage people that if they're unvaccinated, at least for indoor activities, not either they might, or encourage them that they have to wear a mask and be honest about it, or not show up just because of the vulnerability of those within our age group.
Right. And if you were to have an outbreak in that setting, certainly maybe that would, you hate to get to that point, but maybe at that point you would say that it's required and you're going to ask for verification of that. Hopefully that doesn't happen and that's not the case and people will be honest and do the right thing. You know, and enjoy the activities that they love indoors and be without masks outdoors. But, you know, you could even ask people who aren't vaccinated to only participate in outdoor activities unless they want to wear their mask. I think it's all in the message and the finding what will motivate people to do the right thing. And it's hard. It's hard to do that.
Yeah.
We had to shut down things because people weren't doing the right thing. So, you know, it's right now they've had fatigue for a long time, and I don't have my mask at hand, which I usually do, but it was the simplest tool that could have kept us open all along is wearing a mask. So I would hope that they've learned that by now.
How many is an outbreak? Just out of curiosity, you just threw that scenario out. Is it 2 people, I think, or?
Right, so the state health department actually just changed the outbreak definition as of yesterday. It is now 5 people instead of 2 unrelated individuals, with only the connection being within that facility or event or whatever. So now it's actually 5 that would define an outbreak.
That's good for the senior center to know that.
Yeah. But even if you see one case that spread, it might not be an outbreak, but that's certainly a red flag, right? That would be concerning to everybody involved to say that we know that it happened here because there were they were not connected anywhere else outside of the center. So you wouldn't have to wait till it got to the outbreak definition before maybe changing how you approach events.
Okay, one more question for Amy? Anybody? We're coming up to 5 o'clock here. I think we're good. Well, thank you so much, Dr. Wineland, for presenting to the Summit seniors, and your YouTube video is going to be watched over and over again. So, and I thank you for pointing out how to go onto the website to see those updated charts. We really appreciate your time. I forgot to mention, when you first came on, you were awarded quite an honor earlier this year for your handling of the COVID-19 pandemic here in Summit County. So we thank you so much for all of your hard work and your department.
Thank you for that, Joan. It was certainly a community effort. It definitely took a village to make it happen. And we have a lot to be proud of. We know in prevention, we measure success by, success means after the fact, people will look back and think we did way too much. We overreached, but we'll never know how many lives we actually saved. We do know in a report that came out last week that Summit County and Pitkin County have some of the lowest mortality rates out of the 20 healthiest counties across the nation. So I think that signifies, that we did the right thing, and we absolutely need to believe we saved many lives because of it.
Wow, good.
And it's good to be open again.
Oh, yes, thank you. Okay, I think we'll wrap up the meeting now. Have a wonderful upcoming vacation.
Thank you. Thank you.
And thank everybody for participating today. And I think we'll close the meeting now. Thank you so much, everyone.
Thank you.
Stay safe.